Hi guys, this is Dr. Prathyush, Consultant Orthopaedic Surgeon, Pace Hospital, High Tech City. To know what is herniated disc, first of all, we need to know what a disc is. Disc is something, it is a gelatinous material that is present between two bony things in our spine. So, two vertebral columns. So, if we can see gelatin material, if there is any pressure between the two bones, what will happen is that a herniation disc, the disc will protrude a little bit outside to this with the tear that is present in the annular region, which causes a slight bulge in the disc, that is called herniated disc. So a basic disc is mostly composed of, it is a gelatin material mostly composing of water. Because of the pressure situation, first what will happen is it will become dry, that is a stage 1. Next it will become a little bit protruded, that means it will come a little bit outside, that is called a protrusion, and then it will come complete outside, that is herniation, and then it will get separated from that region, and that is called a sequestrated disc. The causes of herniated disc are generally divided as per the person individual. It depends on the age, sex of the individual, type of occupation that he is doing, and along with any previous history of trauma, and mainly because of the posture of normal sitting. So coming to the age, elderly age people, because of the osteoporosis, they will have this compression and excessive bone growth that will cause this herniation of the disc. And the second thing, coming to the sports or any kind of an injury to the spine, that will cause it off. Coming to the risk factors of the herniated disc, generally elderly people are most commonly at risk, especially people with smoking, and people who has a repeated trauma will have this. Few of the incidents we have seen people having genetical variation for the discs, but it is not proved clinically till now. So the common signs of the herniated disc is acute pain in the spine because of the herniation disc, which won't be radiating unless or until it is causing some kind of a nerve compression. So when the nerve gets compressed because of this herniated disc, what will happen is there will be a radiating pain to the whole, whatever the nerve root that is supplying along the course of the nerve. For example, it's of sciatica is one of the good example for that herniated disc that is commonly present and commonly seen in the individuals nowadays. The most common complications of the herniated discs are like one thing, patient will be having a severe pain and discomfort, and he won't be able to perform his regular activities. Second thing, the radiating pain that is present because of the nerve irritation of that disc that is compressing the nerve root. And the third most important thing is a cauda equina syndrome. That is example, at the level of the S1 level, there will be a lot of nerve roots that will be present. So any disc that is present at the level of S1, what will happen is it will compress the nerve cords. So this will cause the cauda equina syndrome. The cauda equina syndrome consists of mainly saddle anesthesia, decreased in control of your urine bladder, and a complete numbness in your lower limbs, like that. That is an acute stage of presentation that will happen. So if people are having any one sign of this thing, it's better you get evaluated by the nearby neurophysician or an orthopedic surgeon. Generally, herniated discs, people coming with low back ache, generally we carefully examine the patient physically first of all, and then we go for the testings like X-rays, MRI scans, and ENMG, depending on the patient's condition and the type of signs we get in the physical examination. Herniation disc curing, generally it will take a lot of procedure. Like if the patient is diagnosed with the herniated disc in the initial stages, with the help of rest, physiotherapy, and proper treatment in the initial stages, some people have seen reversal of this herniated disc, but it depends on the staging of the person's herniation, the output will be. Regarding the healing of herniated disc on its own, generally herniated disc never heals on its own unless or until it is treated particularly by qualified doctors. We generally see in acute stages, and if the bulge is very high, then only we will see a spinal stenosis seen in the individuals. Small herniated disc will not cause, but a severe herniated disc, like after the herniation, it will be converted into a sequestrum. In those stages, we can see compression of the stenosis of the spinal cord. Coming to ankylosing spondylitis is a completely different topic. First of all, ankylosing spondylitis is nothing but causing excessive bone growth in your bones, which itself causes decrease in the joint space, and obviously there will be the decrease in the joint space, decrease in the mobility, spasm in the muscles, the disc will be bulged, and the herniation will happen 110%. The best position to sit in an herniated disc, especially in people who are having constant and prolonged amount of sitting, especially in IT corridors. So what we suggest is generally to wear a lumbar corset support pillow while sitting for a prolonged time. Second thing is physiotherapy is one of the things that is mandatory for all the people who are having herniated disc, because that is the one thing that will cause or prevent the further herniation of the disc and relaxes as muscles. Yes, physiotherapy generally helps in the herniated disc, that too in the initial stage, but in the later on stages with the herniated disc severity and according to the symptoms, it differs from patient to patient. See, the difference between herniated disc and sciatica is generally sciatica is caused because of the herniated disc. There is no difference in both of them. Because of the herniation of the disc or the disc bulge, it will compress the nerve root, so the patient will have pain along the nerve root. Nerve root means wherever the nerve supply, that nerve which is getting compressed supplies, there the patient will be having pain. That is simply called as a sciatica. That's it. Generally, initially, herniated disc can be treated either by orthopedic surgeons or by a neurosurgeon. So, depending on the patient feasibility, he can go and have it checked.